everybody, Kristen with Enlight Physical Therapy. So today we're going to be talking about tennis elbow. Now, I am not the best tennis player, but I do have some experience in treating tennis elbow. Tennis elbow, the funny thing is, only about 3 to 5% of cases of people who have been diagnosed with it actually play tennis. The majority of cases are due to people in contracting positions or painters or just laborers that use their hands. So if you're using a hammer a lot or painting up and down a lot, different activities like that tend to aggravate that elbow and create tennis elbow. So tennis elbow is the common term for lateral epicondylitis. If you look at your elbow, just like this, you have two epicondyles, or the little bumps right around this elbow. You have one on the inside, one on the outside. Now this outside one is the one that's going to be giving you your trouble if you have tennis elbow. So you have all of these muscles right on the back of that forearm that do this motion. They extend your wrist, okay? And if you do this motion, you're feeling it, you can usually feel them kind of pop up under your fingers. Now the tendon is what attaches the muscle to bone. So in this case, these tendons attach these muscles on the back of your forearm to that bony part, that lateral epicondyle right on the outside of your elbow. And that's what those tendons are the ones that become a problem when we have lateral epicondylitis or tennis elbow. It's usually caused by overuse injuries. So like I mentioned, if you hammer a lot, or use a screwdriver a lot, if you paint, or hitting that, that backhand when you're playing tennis. That's all what aggravates those muscles, aggravates those tendons, and you get teeny tiny tears in the tendons. And that's what starts all that pain and swelling and inflammation, and then it just kind of starts getting worse and worse and worse if we don't take care of it properly. In this video, we're going to be talking about several exercises that are designed to help treat lateral epicondylitis or tennis elbow. The first one is just a series of stretches that are really beneficial for targeting those muscles that are involved. So the first one, you're going to take your arm, hold it out in front of you, and you're just going to very gently pull that hand back. And you should feel a stretch right along here. You'll generally feel it. So the biggest thing is that you stay with what you can tolerate. Don't pull too far and don't cause pain. Gentle stretch, very, very gentle. Hold for about 10 seconds, and then you're gonna relax, okay? And we'll do about 10 of those. So 10-second holds, nice and easy, and then release, and we'll do 10. And then you're gonna flip your hand over and pull back this way. So you'll feel this stretch right on the front of your forearm. We'll do the same thing, holding about 10 seconds, and then release, and we'll do that 10 times. Those are the best stretches that you're, pretty simple, all right, but very effective for a problem like tennis elbow, all right? And the third is just wrist circles. So here, until your palm is facing up, and then you're gonna twist and turn until it's down. The next exercises that we're gonna be going over focus on eccentric strengthening. So eccentric is when the muscle contracts, but it lengthens, as opposed to concentric, where the muscle contracts and it shortens. So what you're gonna be doing is taking your arm, kind of place it. You can do this at a table. You can do this just sitting, kind of like I am, with your arm resting on your leg or resting on a pillow, whatever's comfortable for you. Turn your forearm over and your wrist and your palm over so that everything's facing down. And all you're gonna do, take your other hand and help your wrist up, let go, and slowly lower. I recommend a 5-second count on the way down. Nice and easy. And then lift up, and then slowly lower so that we're focusing on that eccentric contraction of that muscle. Those tendons like eccentric contraction, because eccentric contractions help heal the tendons when they have those little teeny tiny tears in them. And we're helping it up so that we're not straining it with that concentric contraction, because it's already been overused at this point. We don't want to overuse it anymore. So we're going to kind of help it up and then slowly lower down. You can do this with no weight. If you feel it when you're doing it with no weight, don't add any weight. If you're doing this and you're thinking this is really, really easy, add a pound or two, but don't go any higher than 2 pounds at this point because you're just gonna prolong the issues that you're dealing with right now. The second one that we're gonna be doing is we're gonna stay in this position where we're gonna focus on that elbow. So you're gonna help the arm up and then you're gonna slowly lower. Again, that 5-second count on the way down. Help it up and slowly lower. Same thing, focusing on that eccentric contraction. And again, start with no weight and then add it incrementally as you can see what you're able to tolerate. So for these, both of these, I would recommend about 2 sets of 10 at least once a day. And that'll help start to rearrange those tendons and improve. For this next exercise, you're gonna wanna prop. I recommend a towel, all right? These are like 2 dish towels kind of rolled up as one. You could use a hand towel, you could use a face towel, anything that you have, but nothing too thin or nothing too thick. You wanna be able to kind of grip it in your hand, all right? So you're gonna take it and all you're gonna do is gently squeeze. All right, again, the same with a lot of these other exercises, you don't want to cause pain. Some discomfort is gonna be normal. You're dealing with a bit of an issue right on the outside of that elbow. So anything is gonna cause some discomfort, but we don't want it to get to the point where it's full-blown pain or it's intolerable. So squeeze, hold for about 5 seconds, 5 good seconds, we're talking Mississippi seconds, and then slowly release. And then squeeze, 5 good seconds, and then slowly release. About 15 of those, and I would do that a couple times a day, about 2 to 3 times a day, working on that grip strength. Because when you have an issue with here, and you're not getting the same strength through that forearm and into that hand, grip is one of the things that goes, all right? And then the next one, which we're gonna use that handy dandy towel, is a twist. So you're gonna take it in your hand, and you're gonna twist one way, and then twist the other way, just like you're wringing out that towel. Just like it got wet, and you need to wring out that water. So we're gonna twist, hold for a couple seconds, not necessarily 5, but 2 to 3 seconds in each position, wringing out that towel. And what I would do is say, here's there, that's 1. So back and forth, that's 2. And do about 10 total, probably twice a day. So whenever you're gripping that towel, do the grip and do the twist, both, and do those 2 to 3 times a day. The last thing I want to discuss in this video is in regards to massage and ice. They're not necessarily exercises, but they're modalities that can be very beneficial in treating lateral epicondylitis or tennis elbow. So if you have just a bag of ice, that works, okay? Ice is great, is good in this case for helping to control the inflammation. Or what we do generally in physical therapy for this issue is we take like a paper cup, one of those cups that you get by a water fountain or that you used to have when you brushed your teeth and you would, spit and all that stuff. Take one of those cups, fill it with water and freeze it. And then you can rip off the top of the ice and then you do what we call an ice massage. It's not the most comfortable thing at all. And generally you don't have to do it for more than a minute or 2 to get the benefits, but that really helps in controlling the pain and the discomfort of tennis elbow. And then along with ice, probably before the ice, I would recommend massage. So you can do it by yourself. You just take your fingers. You can do it without anything, or you can put a little bit of lotion on there, some cocoa butter, or even better, the cocoa butter that has vitamin E in it, and just put it on the area, and then you just want to go ahead and massage. I really hope you found these exercises, this information beneficial. If you have any additional questions or you would like some additional assistance with your problem, we would be happy to see you. If you live in the greater Orlando area, we're a phone call away or a little email away, and we'd be happy to help you with whatever we can. If you want some more information on lateral epicondylitis, we have the link to our blog in the description for this video. And I hope you guys have a great week. We'll see you next time.